Salary Establizo from BSN2D, and I am your student nurse for today. In this video, I will be performing APGAR Scoring by Virginia APGAR. So, APGAR Scoring is an assessment of the physical condition of a newborn in their first moment of life. This assessment will help the health practitioners to decide whether a newborn needs an immediate care. So, APGAR Scoring is performed 1 minute and 5 minutes from delivery. So, in the first minute, it will determine how well the baby tolerated the birthing process. In the next 5 minutes, it will determine how the baby is doing or how the baby is adapting. APGAR has 5 criteria. A is for appearance or color. P is for pulse or heart rate. G is for grimace or reflex irritability. A is for activity or muscle tone. And R is for respiratory. So in this criteria, the baby will be scored from 0, 1, and 2. First, let's check the appearance or the color of the baby. The baby will be scored 0 if the skin looks blue, bluish gray, or pale. And the baby will be scored 1 if the body is pink and the extremities is blue. So let's check the extremities. And the baby will be scored 2 if the entire body is pink. So next, we're going to check the pulse or the heart rate of the baby. We're going to check it on the apical pulse or just below the nipple line of the baby. So remember, our patient is a baby. It is very fragile, so be careful. So we're going to count the heartbeat of the baby within 1 full minute. The baby will be scored 0 if there is no pulse, 1 if it is less than 100 beats per minute, and 2 if it is greater than 100 beats per minute. Okay, so now let's check the grimace or the reflex irritability of the baby. Reflex irritability refers to the response of the newborn to some form of stimulation, just like suctioning the mouth and the nose of the baby. Suctioning the mouth and the nose of the baby will clear the airway and at the same time will elicit responses like sneeze, coughing, and facial grimace. So the baby will be scored 0 if there is no response at all, 1 if there are facial movement, and 2 if the baby coughs, sneeze, cry, or pulling away. So now let's check the activity or muscle tone of the baby. So the muscle tone refers to the amount of motion of the extremities of the newborn. So the baby will be scored 0 if the muscles are loose and floppy or no movement at all. The baby will be scored 1 if the arms and legs are flexed and with a little movement. And the baby will be scored 2 if the baby is active and spontaneously moving. Now let's check the respiratory or the breathing of the baby. This refers to the respiratory effort of the newborn within 60 seconds and 5 minutes of life. The baby will be scored 0 if there is no breathing,